I think it's important at this point to really take a closer look at the benefits and cost effectiveness of implementing a safe moving and handling of people program. To quote OSHA directly, businesses that have implemented injury prevention efforts focusing on resident lifting and repositioning methods have achieved considerable success in reducing work-related injuries and associated workers' compensation costs. Providing a safer and more comfortable work environment has also resulted in additional benefits for some facilities, including reduced staff turnover and associated training and administrative costs, reduced absenteeism, increased productivity, improved employee morale, and increased resident comfort. These guidelines provide recommendations for employers to help them reduce the number and severity of work-related musculoskeletal disorders in their facilities using methods that have been found to be successful in the nursing home and healthcare environment. To really drive the benefits home, I'd like to start with 3 public case studies that were provided by OSHA. First, let's look at Wyandotte County Nursing Home in the Upper Sandusky, Ohio area. They've implemented a policy of performing all assisted resident transfers with mechanical lifts and have purchased electrically adjustable beds. And according to Wyandotte, no back injuries from resident lifting have occurred in over 5 years. The nursing home also reported that workers' compensation costs have declined from an average of almost $140,000 per year to less than $4,000 per year. Reduced absenteeism and overtime have resulted in annual savings of approximately $55,000, and a reduction in costs associated with staff turnover have saved an additional $125,000. Secondly, after implementing a program designed to eliminate manual lifting of residents, the Sholkoff Health Center in Niagara Falls, New York, reports a downward trend in the number and severity of injuries, with lost workdays dropping from 364 to just 52, light duty days dropping from 253 to a mere 25, and workers' compensation losses falling from $84,533 to $6,900. Thirdly, and the last case study I'm going to look at, is Citizens Memorial Healthcare Facility in Bolivar, Missouri. Establishing an ergonomics component in the existing safety and health program was reportedly followed by a reduction in the number of OSHA recordable lifting-related injuries of at least 45% during each of the next 4 years, when compared to the level of injuries prior to the ergonomics efforts. The number of lost workdays associated with lifting-related injuries was reported to be at least 55% lower than levels during each of the previous 4 years. Citizens Memorial reported that these reductions contributed to a direct savings of approximately $150,000 in workers' compensation costs over a 5-year period.